Hi everyone, my name is Sahana Somasegar and I am a current resident at the University of Chicago. I have had the opportunity to work with Dr. Josephine Kim, Dr. Diane Yamada, and Dr. Sarah Ackroyd at the University of Chicago. Today I will be presenting our research titled Association Between Time to Adjuvant Chemotherapy and Outcomes in Low-Grade Ovarian Cancer. Low-grade ovarian cancers comprise less than 10% of all ovarian cancers and are relatively chemoresistant compared to high-grade subtypes. Previous studies have shown that a delay in adjuvant chemotherapy for high-grade serous ovarian cancer is associated with worse survival. However, no such relationship has been studied in low-grade ovarian cancers. The objective of this study is to determine the association between timing of adjuvant therapy initiation and survival outcomes in patients with low-grade ovarian cancer, fallopian tube cancer, and primary peritoneal carcinoma. We conducted a single-institution retrospective cohort study of women with at least FIGO stage 1C grade 1 epithelial ovarian cancer who underwent primary surgery followed by adjuvant chemotherapy from 1996 to 2019. Patients were divided into two groups based on the median timing of adjuvant chemotherapy after surgery, with standard defined as less than or equal to 45 days and delayed defined as greater than 45 days. The primary outcome was median progression-free survival. Secondary outcomes included overall survival. Kaplan-Meier and Cox regression survival curves were calculated. Statistical comparisons were made with significance at p-values of less than 0.05. 39 women were included in this study, of which 19 women, or 49%, were in the standard group, and 20 women, or 51%, were in the delayed group. Age, BMI, race, tobacco use, Charlson Comorbidity Index, number of adjuvant treatment cycles, maintenance endocrine therapy, and median follow-up were similar between the two groups. The majority of patients had ovarian cancer with serous histology and were stage 3. Cytoreduction status was also similar between the two groups with a p-value of 0.89. There was no significant difference in median progression-free survival between those who received standard versus delayed adjuvant chemotherapy, with a median progression-free survival among the standard group of 150 months compared to 148 months in the delayed group, with a p-value greater than 0.05. There was also no significant difference in overall survival at 5 years, with a 5-year hazard ratio of 3.80, 95% confidence interval of 0.79 to 18.3, and a p-value greater than 0.05. 10-year median overall survival estimates were not reached for either group due to longevity of life for these patients. 19 patients, or 49%, recurred at a mean of 48.6 months. 3 of these cases occurred at greater than 10 years after diagnosis. In conclusion, in this small population, a shorter interval between primary surgery and adjuvant chemotherapy initiation and treatment of low-grade epithelial ovarian cancers was not associated with improved long-term overall survival and no difference in progression-free survival. These limited retrospective findings should be considered hypothesis generating, and validation of these findings within a larger cohort is warranted. Thank you.